tell me if I'm wrong. I'm thinking it's this puffiness here and the puffiness there that bothers you. Is that right?
That, and there's also kind of a line down here that.
This line here?
Yeah, and then the same thing over here.
Right. So if we could do, let's see, that. That's what you want.
A big difference.
Yeah, it's a big difference. Yeah. You have a classic herniation of the fat pads of your lower eyelids, okay? And you even have a lot laterally. There are three compartments of the fat pads in your lower eyelids. You have a medial compartment there, and that's really not so bad. You have a middle compartment, you can almost see them as I outline them, which is pretty bad, and then you have a lateral compartment, which is really, really bad.
Mm-hmm.
Okay. Now, if I do this, I'm going to gently press on your upper eyelid, okay? You can really see those fat pads bulge out, can't you?
Mm-hmm, sure can.
Okay. Now, one of the reasons you have a line there is because those fat pads, light is coming down from the ceiling, those fat pads essentially cause a shadow, okay? Because the light's not going over the mountain. If you take out the mountain, even when you smile, it looks a little bit better. When you take out the mountain, oftentimes that line goes away. Now there's other really meticulous, fancy surgeries we can do that can actually fill in that area, and I've done that before, but I don't think you need that. I think you need a straight lower eyelid blepharoplasty, and I may take out a little bit of skin at the same time. Now, to do that, I do that here in the office too. We find an incision, we either find a wrinkle or I go right underneath your lash line, okay? And I lift up the skin and muscle of your eyelid like the hood of a car. And then I find those little fat pads and I remove them. I don't remove them all because there's a function. They act as a shock absorber for your eye in orbit. But I remove the fat that is prolapsing, actually kind of herniating out above your orbital rim. And I put a bunch of tiny little stitches in there, okay? And that we do here if you want in the office as well. Some patients want to do these in the hospital under general anesthesia. We could do that, but I think it's just as safe here to do it here under local anesthesia with my assistants in my operating room here. The answer is, to your question, could they be both done at the same time? Yeah. You know, we'll have to give you some prices and then look at my schedule and let me know if that's what you want to do.
Tell me about the amount of time it takes to heal from both upper and lower.
The upper eyelids, the stitches, you have two type of stitches. Okay, you have stitches that dissolve and are about the thickness and color of my hair. Okay, then you have stitches that need to be removed and they're about the thickness and color of your beard. Okay, so you have a hybrid. The stitches that need to come out in about a week. The other stitches just dissolve. The stitches we put in your lower eyelids, they dissolve in about a week to 10 days. So it will, after the surgery, you'll have tiny little stitches in so people know that you've had something done. Some people experience a little bit of bruising. It's just really more you than me. Some people bruise, some people don't at all. Can you go to work the next day? Yes. If you meet the public, then people are going to know you've had some eyelid surgery. We could do it on a Thursday, and you could take Friday off, and Monday you can wear your glasses, and it's amazing. People are just not very observant. You know that. You know.
Actually, that was kind of I was actually thinking maybe even Wednesday.
Yeah, we
to
could
Tuesday.
do that. Yeah, that's up. But if you, as far as computer work is concerned, you can be on a computer the next day.
No, my job, I'm out and about on the floor too. So.
Well, then people are going to.
We got a lot of people contact.
Yeah, then that's okay. You just tell them you had some eyelid surgery. Say, oh yeah, really? Okay. All right. What about this project? Let me just do a couple things. I'm going to get in a little close in person. Molly, this is called a snap test. Did I show you this before, Molly?
Yes, you did.
Yeah. So when you pull that back, you see that there's it bounces straight back. Okay. If they have to blink to get the eyelid to go back to the cornea, or if they have to push it back up, then that's not a good snap test. But this is a good snap test. That means you have a really good tight ligament, so the risk of having an atropion or your lower eyelid pulling down is very, very minimal. Okay.